Good morning and happy National County Government Month. My name is Dawn Dudley. I'm the Senior Public Information Specialist for the Durham County Manager's Office, and I am happy to welcome you to COVID Stories. This is our first of 4 opportunities to sit down with Durham County employees who will share their personal and professional stories related to the coronavirus pandemic. Today, we are joined by our first guest, Maria Santiago. She is an income maintenance caseworker for the Durham County Department of Social Services.
Good morning.
Good morning, Maria. How are you today?
I'm fine.
Good. I'm so thankful that you're here this morning and you're sharing your story with us. I'm really excited to hear about your personal story and also your professional story and how the pandemic has impacted you. I know we all have stories, unique stories, and I'm looking forward to hearing yours. Before we get started, share with me and those who are watching today what your name is again and what you do for the Durham County Department of Social Services.
My name is Maria Santiago and I income maintenance caseworker too. And I work with Medicaid. I do the reviews so every people can have Medicaid.
Okay. How long have you been working here with us at Durham County Government?
10 years.
10 years. So 10 years, that's a pretty big commitment to your job. So I think that you would like your job, right? You enjoy your job.
I love it. I was praying God to give me a job where I can speak Spanish and English, and this is the correct environment for me. And I have a caseload with Hispanic population and English population.
That's great. So what does your job, tell me a little bit more about what your job looks like day to day.
Day to day, I have for a month, 150, depends on the months, can go up, can go down, but that's my caseload and I need to work with them to see if everybody has the income and evaluate them to give them the Medicaid.
Medicaid, okay. So if a person speaks Spanish or English, they could end up interacting with you, or do you only work with the Spanish speaking population?
I work with both.
With both.
Mm-hmm.
Okay, very good. So let's get into the conversation about the pandemic and how it impacted your job. So last year around this time, so here we are in April, we were in full swing with the coronavirus pandemic,
Mm-hmm.
and it was definitely that point altering our jobs. By March 23rd, I believe it was, when we began to alter how we were delivering services for the county.
Yes.
How did it change for for the Department of Social Services, but particularly for your area?
It changed drastically because from work from an agency and a building, I need to start working from home and do a space, some kind of space to work with all my things in my home. And I think was a blessing for me working in my home because I love it. I just love hear the birds singing and I love to keep going and I'm in peace working.
So it made you feel, I guess, more productive.
More productive and more safe and relaxed.
Yeah.
Even though I have the stress of my caseload, but I'm relaxed at home.
Right. So before the pandemic, your customers would meet you at the social services department
Yes.
in order to receive or start the process. So what does the process look like now when a person is seeking Medicaid or they're going through the income approval process?
Well, I send them the notification that I need the income for that particular month, and they can now call me by phone, write me a letter, email the information I request, or they can come to the agency. They don't going to see they don't going to see me, but at least they're going to see somebody in the front desk, and they have the ability to make a copy of the documentation I request and put it in an envelope. I make sure when I call them or when they call me to give them my name and the county case number, and they put it in the envelope and put it in the mailboxes outside the office, so they can put that information secure over there, and the people in charge to the mailing, they put it in Laserfish. There's a system inside the computer, and I receive that information to my email.
Got it. So there's a pretty efficient way that you all are conducting business and keeping things going,
Yeah.
even though there's been a change. So most of your engagement with the community now is by phone. Do you do any virtual calls, like Zoom meetings, or get on any type of face-to-face, on the computer with your clients?
No, with my clients, but we do weekly meeting virtually by Teams software, and with the supervisor and my other coworkers.
Okay.
And it's a blessing because we update every time, every week. We've been updating any information, any new things is coming up. So we are updating every week.
So you meet virtually with your coworkers, but primarily with the public, you're talking to them on the phone whenever you're interacting with them. So you said that you hear the birds singing, and you are able to be at home in your normal environment. What do you miss most about being here in the building? Like, what part is missing for you?
My coworkers. We used to make jokes, talk a little bit, and it's like we're missing that part, but we gain another part. We gain our families. We're going to be more connected. I don't know another people, but for me it was a blessing. I connect more with my husband, and we are more like praying more for each other. That little thing in situation, now we confront it together because we're home, and it's for me was a blessing.
Yeah. So tell me more about home and how the pandemic has impacted home. I know you talked about the positives of being able to connect with your husband. Is there anybody else at home that you interact with? I think that you have a dog, right?
I have a doggie. Her name is Princess, and is a Chihuahua. It's a small dog, and she loved to death. She sit next to me, and she loved it. She loved it.
Yeah, I'm sure she misses you now that you're here, maybe in the building a little bit more than you were last year this time.
Yes.
Yeah, so I know that you shared a little bit about your personal experience with COVID. We had a conversation before. We talked about how, a lot of us have stories of people we know impacted by COVID in one shape or another, whether it's their jobs or actually being impacted by the disease by contracting it, or knowing other people going through the strain of COVID-19. Tell me a little bit more about your personal story related to COVID.
Well, in January this year,
Yeah. Was it January 2020 or January 2021?
No, wait a minute. This year.
21,
This
yeah.
year, because I was on vacation. When I returned, I didn't return because I have the COVID.
Okay.
On January 8th, I get the COVID, and then sooner or later, 3 days passed, my husband got the COVID too. So at least was mild, but we was afraid.
Yeah.
And when they said to me, "You have COVID," it's like, oh goodness, I'm gonna die.
Oh.
That's the question we confront when we hear, well, at least me, when I hear COVID, too many people are dying around me, and no my friends, no my family, but at least it's people. And I was praying because that put me to cry for those people, for those families. And I said, Jesus, what is going on? And I pray more. And when I have the COVID, I have only the system of the flu. Only that. A headache, a little fever, and then the joints hurt. But at least I have the opportunity to work. Give me the opportunity to work, and I was working all the time of my COVID quarantine. So I finished my COVID quarantine, and I said to my doctor, I'm ready to the vaccine. I don't want to get this one. This one was mild, and I passed it, but I don't want to get it again. And she told me you need to wait a little more, but you can put your name in the waiting list. So finally, my husband and I are vaccinated. We are vaccinated already. Praise God.
And then you feel like a sense of relief by
Yeah. But recently, last Sunday, Sunday or was Saturday, I was in my Facebook and I noticed a friend of us pass away because of COVID.
Yeah.
And it's painful. It's still there. We need, even though am vaccinated, I have a mask over here. And I keep washing my hands, and I have my 6 feet away. I don't want this to touch me no again. And I want everybody to understand this is real. And I don't want it no more. Die here. I don't want. And I keep praying, for those lives, because they gone, but the family is still there, and they confronted this. And if we keep our safety and don't get down and relax, because this is real, so we can pass this new year, we can say we are free of COVID.
So it sounds like, you had a pretty rough, even though it was a mild experience,
Yeah.
your overall experience, it was tough for you. It was emotional, and you got to see various sides of what COVID can do, both personally and professionally for your life. What is your biggest takeaway from this experience? You can speak to either your personal or professional aspect or perspective related to that question.
In my productivity, I'm more productive. I can tell you I'm less stressed about the environment I'm in, because I'm more at home than in the office. I less exposed to the outside, and I love nature. I learned how to use Zoom team more. And I can tell you, that's a blessing. We can do this through the computer.
Right.
That's completely, I'm grateful the county give us the opportunity to do it, and they do it fast. That's a blessing too.
So you feel like your skills have increased and your opportunity to be more connected with your family has tremendously grown, and so it's just a win-win for you.
Yeah, for me, yeah. I love to be home.
That's good, and I'm glad that you're able to continue to serve your clients and be productive, and I think that that's really important for the public to know that you still want to be there for them, and you're so very committed, and we have the tools to be able to support that service need.
And also when a client called me and they said they have COVID, they cannot go nowhere. At least we have the tool now to self attestation. So they called me and I got that information, and they need to come here. And I said to them, don't move from your house,
Well, you're clearly a very compassionate individual, and it's been a pleasure talking to you, Maria. I appreciate you sharing your COVID story, and this month we'll have several other of our employees sharing their stories. Is there any last thing that you wanted to say before we sign off from today's COVID story?
Be blessed and be safe and follow the guidance. Use your mask, 6 feet apart, and wash your hands.
Sounds like you have that down pat, and you've said
And
that a
get
lot.
vaccinated. Yeah.
Yes. Well, definitely. Again, thank you so much, Maria, for sharing your story. I really appreciate it.